All right. Well, thank you all for joining us. We have this really interesting conversation set up for you this afternoon. My name is Pierre Vigilance. I'm the Associate Dean for Public Health Practice at George Washington University, the Milken Institute School of Public Health at George Washington. Um, and my role here this afternoon is really as a moderator, because we've got some subject matter experts here to talk about a very interesting topic related to wearable technology and scaling the use of wearable technology for population health outcomes, potentially. So this is a combination of a public health conversation, a design conversation, an access conversation, health equity, global health, business, storytelling. I think this has the potential to touch on a whole bunch of different areas, but hopefully those of you who are joining us this afternoon get something out of us having this conversation. I'm joined by a few different folks, so I'm going to let them introduce themselves, but on the line, just so you know, we've got Autumn Saxton-Ross, Dr. Saxton-Ross, who's going to be talking to us a little bit from a health equity lens. We've got Blair Palmer, who's with the UNICEF Innovation Lab, Teresa Wang, who is with us from Rock Health, and Jacqueline Pablos over at Health Leaders Media, who are going to be helping us sort of move this conversation along from a few different perspectives, but relating to wearables. So we don't have a lot of time, so I'm just going to let people just give a 2-second intro on themselves, and then we'll jump into these questions, and we look forward to getting questions from you who are watching as well. All right, so Autumn, if you could start us off, 2 seconds about yourself and why this is an important topic.
Good afternoon, everyone. I'm Autumn. I am the Program Director for Place-Based Initiatives here in Washington, D.C., in a small nonprofit, the National Collaborative for Health Equity. And so what we do is really use people in the community as the solutions for health equity and health disparity problems of their community. So identifying and addressing social determinants of health as a way to improve health outcomes.
Excellent. Thank you. Blair?
Pierre, did you pass that to me?
Yeah, you're up. Your turn.
Hi. I'm Blair Palmer. I'm with UNICEF's Innovation Unit, and I'm the lab lead for San Francisco. A lot of our work in San Francisco focuses on how we can create technology partnerships with the likes of Facebook, Twitter, but small and large companies, as well as how we use technology and design internship programs. I'm just recently launched a Wearable challenge in May, which actually ends today, and so I'm the lead on that project as well. And thanks for having me.
Thank you for joining us. Jacqueline, if you could sort of give us an intro yourself as well, and then Teresa.
Sure. Well, thanks for having me. My name is Jacqueline Pablos. I'm a senior editor at Health Leaders Media, and what that means is I write a weekly column on physician leadership, and I contribute a monthly feature to our monthly magazine, which is called Health Leaders. This is an important topic because what I do typically and mainly is talk to C-suite leaders of healthcare organizations and hospitals and physician groups and specialty groups. And what they're struggling to do is move from a volume-based to a value-based world. Population health is a big part of that. And there are some organizations that are doing some great work, but by and large, the infrastructure is not really there to support it dynamically like it needs to be. So I get a chance to report and touch on a little bit of everything that it sounds like these panelists represent, including health equity and disparities. I think that's a very large issue, particularly for this particular topic. So thanks for having me. I look forward to contributing.
Excellent. Thank you very much for being with us. And last but not least, also from the West Coast, is Teresa Wang from Google Health.
Thanks for having me. I'm the strategy manager at Rock Health, and Rock Health is an early stage digital health seed fund, so we invest in any companies that kind of span the intersection of healthcare and technology, and a big growing segment of that is obviously the wearables market. So we get a chance to see companies early in development as well as making kind of our predictions and where we think this space is going. It's a growing interest, and we're excited about the potential of wearables to kind of make an impact on healthcare at large.
Excellent, excellent. Well, thank you all for joining us. You know, this wearable technology piece is nothing very new, but still relatively new, yes. Cutting edge potentially with respect to the population health space, but people have been wearing some sorts of devices for the last few years, Fitbits, fuel bands, obviously there are a couple others, I don't even know all the names. But they've been used by individuals, and then I've noticed a lot in sports. A lot more teams are making use of these various devices to track athletes as they're on the pitch, tracking performance, tracking gains, and actually tracking people during games to make determinations about how folks are doing. And those individual applications and sports applications are both really interesting, but I think that because of the types of things that are measured, as in how much physical activity, how frequently that's being engaged in, and because of that relationship to some of the chronic illnesses that we have, particularly obesity, as one of the major targets, if you will, potentially around this movement-oriented monitoring, we have some opportunities, I think. And so the first question, which goes out to everybody, is how, in your experience, are people making use of wearables beyond maybe some of what I just mentioned, and self-tracking devices, and you know, do any of you keep track of your own health or movement using any of these devices?
Well, I'll take that question first. The only thing that I use is a little pedometer to track my steps, and I've been using that for years. What I do with that information is not much, and I think that that's clear. I think that that is a clear issue for what to do with this information once you have it, because you can have these great tools, but if you're not using the information to improve your health, that's a problem. Some of the interesting things that I have come across in my reporting really go beyond sort of the casual application of here's what I'm doing in my everyday life, and you know, maybe it's making a difference. Maybe since I'm wearing these devices or Fitbits or health kits or what have you, maybe that makes me a little bit more engaged. But some organizations are really going beyond that to try and put a dent in the chronic diseases that you had mentioned. One that I found the most interesting is in a gastroenterology specialist group in Chicago. A gastroenterologist there had partnered with a payer to find out what the costs were for Crohn's disease patients, and found that most of the Crohn's disease patients who end up in the emergency room or in the hospital room do so because they're not keeping up, they're not checking in with their symptoms, and their symptoms get so bad that there's nothing they can do but go to an emergency room. So they took a look at the gastroenterologist took a look at the data and found that if a patient did not have a 30-day appointment prior to a hospitalization, they were more likely to be hospitalized. So they developed a proprietary app that keeps in touch and and is engaged with patients on their mobile device. They push out simple questions. How are you feeling today? Have you used a biologic today? What drugs are you taking today? And by being able to do that in a small pilot group, they were able to reduce hospitalizations from 17% to 5%, and they reduced costs for the payer as well by $95 per member per month. That was a small pilot group, but clearly what he was able to show is that if you're going to where patients are, engaging with them on a regular basis, they're more likely to be more engaged, take better care of themselves, and stay out of the hospital and the emergency room where that care is so expensive. I think that there's definitely an opportunity there, but you have to have physicians who are engaged and understand that the pillars for getting there don't just include something cool, something that's a neat app that a patient can download. It takes IT infrastructure that he developed. It takes being able to partner with the payer who's willing to give you that data to make sure that you are driving down costs. So I'll stop there and let the others go on, but that's an example of something I think is promising that can really make a dent in some of the chronic diseases like that you had mentioned.
If I could ask Autumn, if you would comment a little bit. Engagement is something that Jacqueline brought up a couple times. Engagement of providers, engagement of patients. Talk a little bit about that. I know that some of your work extends into the community, and then I'm going to turn to Blair and Teresa with respect to this same question.
Okay, thanks. So I love that example when we speak about engagement. And so quite often what we have realized with working with communities is that we know that these conditions and these issues are within communities, but we also want to uplift that the solutions to these problems, these community problems, are also within the community. So a wonderful example of how wearables or technology can really affect communities. And it's important to remember it's not geographic communities, but maybe communities or people that share the same issues. Is there are wonderful examples of, text for baby. I know there's a pilot initiative happening with younger people that are HIV positive, thinking about how important it is for them to be medically compliant. If you look at people of color, if you look at young people, if you look at low-income folks, the majority of their internet interaction happens on their phones. So really thinking about how we can use phones as engagement when it comes to health. So whether it's within the healthcare system of compliance with medication, which we all know decreases cost incurred, but also improves the lives of folks that are already vulnerable with some of these conditions. So I think it's very important, like what Jacqueline said, is to really use this technology as a way to increase engagement with these communities that are suffering, or with these communities. So it's not just an individual on their phone, but looking at how communities can be engaged through these pieces of technology, whether they're at a physical location, or whether it's the same folks suffering from a condition, or the same folks that are working on something to make change at a community level.
I think that's a really great point about kind of having these health technologies, apps, and wearables be a means for engagement with the community. But I think it's really important to remember that the onus is largely on these companies, these like wearable companies and technology companies, because today wearables are predominantly used either to lose weight or to stay active. But they're tracking like daily number of steps or how much you sleep, and all of that information is really hard to act upon. So you can't engage with the data that you're receiving. And so I think what we're really excited about is to see kind of measuring new novel physiological measures that actually have a clinical use case or endpoint. So you see like moonshot projects from Google that are making contact lenses that can track your glucose levels, or a health tracking wristband that can report clinical grade data for clinical trials, or patches that can measure your blood sugar levels as well. Once you have more novel data points that are actually clinically useful, you'll be able to engage the chronic patients in a more meaningful way.
And if I could step in here and just kind of have a comment, and it's very important, but when we think about disparities, or when we think about communities that have so many other stresses that are happening to them, and we think about the health behaviors or the environment that individuals are in, to be able to take advantage of this technology. I think it's very important that we have to consider these facts. So me, as someone that is highly educated, throughout my life I've been lucky enough to be in environments or communities that support that health seeking or health preventative or health promotion behavior, right? So we also have to think about, it's on the onus of, these technologies are great, but how do we then help support these health promoting and prevention behaviors in these communities that don't have it, so that as technology becomes more affordable, or as technology becomes the default, everyone has a cell phone, whereas 30 years ago that wasn't possible. How do we ensure that these things are happening at the same time, so we don't once again see this divide of, well, everyone has the technology, but not everyone has these behaviors, or these behaviors haven't been a part of the culture, or haven't been supportive for individuals to take advantage of these opportunities.
Right.
I'm sorry. Go ahead. If I could just mention one thing. I'm glad that Autumn, you brought that up, because it is about having, I think one thing that's important is having access to that technology and the supportive community. And a big part of that support system for these individuals is their physician. You know, individuals who are overweight and obese and are trying to make a dent in their health are really leaning hard on their physicians to help them through that journey. Physicians really need, and I'm not speaking for physicians, I'm a reporter and I talk to a lot of physicians, but over and over I hear that physicians are overburdened. They don't get to spend enough time with patients, but they're interested in making a difference with patients. So while these technologies are coming along and they are novel and they can give you great data points, physicians have to be able to also engage with them and use them in a meaningful way with their patients so that they can develop a relationship that's where a patient who might be in a community that doesn't have a lot of support with these other health-seeking opportunities, they need that relationship with the physician. And so that is a really important part of these wearables is, what do you do with that novel data information? What does a physician do with it? Do they have the IT infrastructure to really do anything with it? Do they have the time? You've got to make it easy for patients, but I think you have to make it easy for doctors too.
So this is really interesting, because I feel like we have a lot of conversations in public health, particularly about the traditional healthcare system and the opportunities that we have in that space. But there are a number of different, very diverse sectors that are very impactful to public health. We speak to them as the social determinants of health. And I know Blair, as a public health person, as an epidemiologist by training, I know that you have an understanding of this from a couple of different perspectives, but being an epidemiologist working with a global organization in an innovation lab probably gives you a very unique perspective on this. So what's your take on some of this conversation about how it's being used, or how these devices are being used, and what some of the potential is?
Great question, Pierre. So at UNICEF, we decided to look at wearable and sensor technology because of the way the industry is growing. And then we also saw the space, and to add to what Jacqueline and Autumn said earlier, that you can take this data and have a lot of rich kind of data, but if you're not looking at it or using it in the right kind of way, then that's ineffective. So how do you create wearable and sensor technology that might not only be for the personal self, but that can also move off body? So it's not necessarily a bracelet that someone's wearing. It could be a smart product, a sensor device, etc., that's collecting information passively on a community. So part of what we did at UNICEF was start the Wearables for Good Challenge. And we also wrote, this is for those listening, we wrote a use case handbook on how to design wearables for social good, which you can find on the website wearablesforgood.com. And it goes through the various focus areas of how you would do exactly that, and looking at the design constraints that would be needed in these last mile settings. So how do you reach that mother that needs to have prenatal care before she has her baby? And what if you had some sort of wearable or sensor device that could allow nutrition monitoring, for example, so that you could ensure a healthy weight baby at the time when she does finally deliver birth? So we're looking at those types of solutions where you're not just thinking about the user, you're thinking about the user, but you're also looking at the local context. And
Okay, we seem to have lost Blair, and we'll pick back up where she left off, I think, in a second. If we could sort of pivot slightly, and hopefully Blair can pick up as soon as she gets back, pivot slightly to this conversation about access and accessibility, because it's come up in the conversation already. And there are barriers, clearly, to accessing the technology for an individual, regardless of their relationships with a healthcare provider, or even a relationship with their own, the depth of their own health issues. There are barriers cost-wise to some extent, and maybe even technology-wise, right? Connectivity between your phone and broadband and all that kind of stuff. Sort of any particular thoughts on what some of the barriers are and how technology companies might consider helping people get around some of those barriers, and that's for anybody to sort of to pick up on. I think, Teresa, you may have some thoughts because of the work that Raquel does with new companies in this space. But Jacqueline or Autumn, I'm happy to hear from you about this as well.
Yeah, I think, you know, like you mentioned, cost is definitely one of the biggest, you know, hurdles to adoption. But I think there's kind of two things that need to be kind of considered before you can really improve access. I think first, people aren't used to paying for anything related to their health, and so it's that shift in mindset. So it's about, I know, you know, a lot of access is about limited resources, but it's what you prioritize. So most people now have smartphones, so you made that purchase, and buying a wearable that can improve your health may, you know, become like another key purchase in your life. But until the wearables can prove to actually make you healthier, no one's going to want to make that investment. But on the flip side, on the industry's like responsibility, I think a lot of insurance companies and self-insured employers are starting to see some ROI for having more patient engagement via like building relationships, wearables, or apps. And I think with them being able to help keep their populations healthier, they'll be able to subsidize these, you know, devices and technologies to really widen the access. And I think now that, you know, hopefully insurance continues to expand in, you know, most of the United States, and you know, a lot of communities will now have access to technologies and health resources that they didn't have before, and insurance companies and providers just really need to be able to see that ROI that wearables can make you healthier.
Teresa's right. It's not just the payers who are looking for a return on investment. It's the physicians that are also looking for a return on investment. And what I hear, and again, I'm not speaking on behalf of physicians. I'm just, you know, giving you what I hear over and over is the steps that patients have to take before they even get a wearable is they have to be engaged in their health. Teresa, you had mentioned until wearables start to change a person's health, they're not going to be widespread. There are a few steps that you have to get to before a patient can see that a wearable is helping them improve their health, because if they're looking to a blood pressure cuff to lower their blood pressure without taking responsibility for medication reconciliation, making sure they're taking their medication, and even that early step, making sure that they're doing everything on their end that they need to do to be able to have information, to be able to have the blood pressure cuff be useful, you get into access issues there with medication. So I feel like there are a few very large hurdles, access hurdles, that have to be conquered before the wearable hurdle is conquered, so to speak, because it's not just about access to technology, it's about access to the things that would make that technology more meaningful, like their medications. I don't know if you probably see more of this than I do, since I report on it and hear examples of it. But you have to have you've got to have some sort of meaningful relationship with that technology in order for it to work. And in order to get to that place where it's a meaningful relationship, there are some big steps I think patients and physicians and healthcare organizations have to take.
Autumn, any thought on the access piece? I do want to sort of bring Blair back into the conversation too, but Autumn, what are your thoughts with respect to this access or barriers to access?
Yeah, just quickly, you know, one thing that we really started promoting, and I know others also, is kind of this both and strategy. So if you think about technology, or if you think about promoting health behaviors through community or through culture, right, you have to have these different touch points throughout these systems. So you have the technology here, but, you know, for people to be engaged, there has to be consistent touch points, whether it's through education. So not just like what Jacqueline said with the healthcare system, but if we think about all the systems that people engage with, those are all possibilities to help with engagement, or to help people really start to use this technology for their own selves. So as technology grows, or these smaller companies or larger companies, how can we invest in education or education spaces so that these children, especially children of color, and people of color, how can we use these different systems that they engage with as opportunities to promote these health benefiting behaviors? So looking at young people and mothers that engage with their WIC, with their Women's, Infant, and Children's Office, looking at how we can make sure that this technology is used within the education system, or how this technology is used within recreation centers and community centers, so that we don't have technology advancing so far with people left behind because these opportunities and ways to engage with folks to make it a part of their lives are kind of left behind.
Good. Good points. Good points. Blair, accessibility and barriers. I know that some of the clients that you work with are in resource-poor areas all over the world, here and abroad. Any particular thoughts that you have on barriers to access that can impact our ability to have wearables be useful for population health outcomes?
Yeah, I think it's exactly building on what Autumn said. So I think successful designs in the space will consider an entire system as opposed to a single point of influence. So you have to think about who are all the people that are involved in the touch points, not only with the data that you're collecting, but how you're serving these people in these communities. And I think for us, you know, everyone's talking about the next billion, et cetera. You know, the billion more people are expected to come online by 2017, largely using mobile phones. So how do you take that technology, which was pretty much 10 years ago, people did not think it would be at the level that it's at right now, and integrate that into existing services and existing infrastructure in order to deliver life-enhancing, life-saving services. So if we can design this with the end user in mind, with the local context, we can actually reach those at the last mile. And I think UNICEF's thinking about that next billion now. So as we're going out there and we're getting ideas and things for even for this wearables challenge, we're saying, and we're actually okay with saying, that we don't know what we don't know, and that this is also doing research for the industry to push something forward. It's looking beyond a quantified self, which is sort of the topic of this conversation, and really looking at how you then qualify that data. What data is meaningful, and how you make it meaningful in order to really show improved health outcomes, improved, you know, outcomes in poverty, education, et cetera. There's a lot of things that you can look at. So from an access piece, we see it as something that can be an enhancement to existing services, and not necessarily replacement for things, but something that could definitely help improve outcomes on all levels and across all of the different pillars that UNICEF works in.
So the thing that's come up a couple times in listening to your comments is, and Teresa mentioned this specifically, the word prioritize, and then the concept of what I'm going to refer to as meaningful use, but not in the sort of the traditional health IT way of thinking about it, but what makes some of this information useful and meaningful to you. Because prioritizing things, gym memberships is sort of an area that I think about this in. So, you know, people sign up, there's that big push between Thanksgiving, Christmas, just after Christmas, every gym is getting you out there, it's getting out there to tell you to join. You prioritize it because of all the wonderful things that you ate at Thanksgiving and Christmas. And then after that, you have a high level of engagement for a period of time. It's equivalent to you looking at the app a whole lot, paying attention to how many steps you're taking, etc. But then over time, it kind of goes down because other things get in the way for whatever reason, or whatever set of reasons. Other issues get in the way. So how can we effectively, is there a way for us to effectively help people be able to prioritize these issues, or is it, as Blair was mentioning just now, because of issues around housing, education, economic development, etc., some of these other pressures, this is really always going to be something that's going to come up the rear, and we're not ever going to be able to really have people paying as close attention to these metrics as we would like for them to. Any thoughts on that?
I think that's a tough question, and I don't know that. I don't know that the many years of discussion will solve that problem, because I think that what you're touching on and what you're bringing up, making something useful to a patient, so that instead of this peak engagement and then it falls off sharply, instead of having something that's more sustained, I think goes back to something that both Blair and Autumn said, which is basically surrounding a patient or surrounding a person with touch points and educating them in the whole, as a whole, and not just leaning on or relying maybe one part of that person's community to get them healthy, but all different parts of their community to keep them healthy and be in a supportive environment. I think of a patient that I talked to for a story that I recently wrote about this very issue, about patient engagement. She was close to 400 pounds, she was diabetic, she had high blood pressure, and she only started going to the doctor because she suspected she had diabetes. And she did have diabetes. Well, she went to her physician's checkup every 3 months. A1C levels, was very good about her medication. She was uninsured at the time. Now she's, I want to say she's down to, I think, 140 pounds. But she did not start losing weight and did not even activate the conversation about losing weight until 3 years into having diabetes. And it was her coworkers introducing her to a health coach at the place where she worked that made her start thinking about nutrition. It was when her company moved near a gym, she was able to start thinking about, well, maybe I could go in a little bit earlier and swim better. When she got a little bit of the weight off, she was able to get out of her wheelchair and walk a little bit. So she had touch points from not just her physician, but also from her work, from her coworkers, and from her church that helped her on that journey. I think you have to surround a person with that's very intense work. So surrounding a patient with all of that takes a lot of work, but I still think that even if that support system was around for every single patient, you would still have those peaks and valleys for those chronic health conditions. I think you can make a big dent, but it's challenging. It's challenging.
So I get that's a very good point, and I wanted to sort of ask Teresa, as I said, question potentially for anybody, but I'm really interested in hearing from folks who might be engaged in some of the early stages of, conversations about connecting people to different things in their lives. So the point Jacqueline just made about surrounding an individual with opportunities for this piece of technology to interact with some other input or some other part of their environment. Jacqueline, I know a good friend of mine, Gabe Klein, talks about smart cities, and The Atlantic obviously a series about smart cities and what does that mean for a city to be smart. There's built environment stuff, of course, but this technology interplay is also important. Have you or anybody else got any thoughts on ways in which, or places in which, we might want wearables to be able to allow us to interact with non-health settings that might impact us on a regular basis, but with respect to health outcomes, or any other innovative connections that we might not have thought about too much?
Well, I'll let the others talk, only because I feel like I'm dominating this conversation, because I'm interested in hearing the same sorts of things as well. I know that there's a community down in Naples, Florida, that is becoming part of the Blue Zones project. That's trying to make the whole community healthier, and being involved in urban planning and having more sidewalks and developing parks. That's a space you don't see healthcare organizations get into. I think you will see that more and more, but they're using technology as a way to connect those communities together as well. That's on a small scale. That's the example that I've seen.
From like the investment side, we're seeing a lot of the engagement coming from kind of online communities and social media. So engaging in fitness and various physical activity competitions or just mutual support through online communities has actually been an incredible way to keep people from to keep people coming back. So it's not necessarily dependent on your geographical community, but just really finding people that are similar to you or in similar places, and you can kind of motivate each other that way. And I think it's important to remember that like wearables aren't going to be the end all be all to help people become healthier. They're really just a means to collect data, and with that data we're hoping that others can act upon it, whether that's the physicians or the insurance companies or the individual, but it's just a means to kind of help find a use case for it. And until the wearables are collecting more meaningful data, then a lot of it will be dependent on the individual user to find a way to act upon it. And so I think having that community support, even if it's virtual, has been really helpful in helping people stay motivated and continue to proactively take care of their health.
Good, good. Blair, what were your thoughts with respect to this?
Hi, sorry, technology and muting. We're looking at this a lot for, in UNICEF's context, one around the alert and response sort of focus area, how you could address this in disasters and emergencies. So what if, back to looking at environments, if you had a sensor device, say in a slum like Kibera, that could detect fire early and immediately send a GPS signal to responders, which usually are those in the community, elders, etc., that could then alert that village. So there's one example of just a community-based response you could create. Something else we're looking at around behavior change, though, and sort of touching on the other points that Teresa and Jacqueline made, is if you could have a device that could alert children that were in schools who forgot to wash their hands. So reminding them that washing their hands and that simple behavior change could then help them from, preventable diarrheal diseases, etc. So simple things like that, where it's, maybe off-body but environmentally based or community-based solutions where you're taking passive data and then alerting people, we feel is somewhere where this technology is going to be most useful. We don't know yet because people are building these types of things now, so we're hoping that with more operational research and trying and testing things that work and don't work, that we can figure out the answers to these questions.
Yeah, and if I can just make a quick comment here, these are really wonderful examples, and just thinking about health in a little bit more of a broad term, I know there was an app that was created by high school students, I want to say in New Orleans, and I can't remember specifically, but if you think about the broad spectrum that health is that they created an app of kind of like knowing your rights when it comes to a school system. So if something happens and there's disciplinary action, there's an app that these students can go to actually know what the school district policy is when it comes to dealing appropriately with that infraction, so that the students know when is appropriate to call for their parents, when it's appropriate for police to be called into the school, and when it is not. So if you think about health in all aspects of health and not just physical health, technology can really help when it comes to educating people on their rights, especially when we know about a lot of the violence that's been happening to young people. So that's a wonderful example of how, something kind of out of the box, that technology can be used when helping people navigate these spaces to make sure that they're healthy and kept alive in all kind of aspects.
Let's stay with you for a second, Autumn, on this issue of sort of community, which Teresa talked a little bit about, online communities, but communities interacting with systems, right? And systems of education, systems of healthcare, systems of employment, justice, etc. I know a lot of your work in the health equity side of things relates to systems and how people interact with those. Do you think that there's an opportunity or potentially a barrier with respect to the way that some systems are already set up and getting people into making use of the wearable technology given their interaction with some of these systems in the past? Or do you think that those interactions, those historical interactions, will make no difference with respect to how much people feel comfortable engaging?
Yeah, so I think that's a good question. So, I mean, I know, for years, because of the way that some folks have interacted with systems, that's going to make them a little more hesitant when it comes to collecting data and who has data, and kind of the historical trauma that a lot of communities have. I think that is definitely a barrier, and one of the reasons that I think all of us have kind of touched on this comprehensive view, right? If we want to create a culture of health, we have to think about how these advancements are then reinforced in every place that we are. So if we want to use technology to promote all aspects of health, it's up to individuals or the people that are creating the technology, or the folks that are supporting it through funds, to really think strategically and comprehensively, how can we ensure that this then reinforces these same messages, right? So we're not telling kids to eat an apple, but then every time they turn on the TV, they see candy, right? So how do we ensure that that culture isn't copied when it comes to technology? I think is a big barrier, and that it's something that isn't just within the individual, but it's something that the people that have the technology or the power within these systems to really think about if getting rid of disparities or thinking about equity is something important. So really thinking about it comprehensively and seeing how these systems then reinforce this message of technology to promote health.
And speaking of turning on the television, you turn on the television sometimes and find out about data having been leaked, information being hacked into, etc., and folks having their personal information being exposed. I hear about athletes on a much smaller scale feeling like guinea pigs because of the way that they're being dealt with, how my performance versus the person next to me on day 1 versus day 2. But on a much bigger scale, the issue of data security is a major one. Blair, any particular thoughts on this systems conversation, and if you could segue us into the data security issues, and then I'd be really like to hear from Jackie, Teresa, and Autumn about any concerns about, is it valid for people to be concerned about how the data that's collected is going to be used, and is it going to be used for their benefit, or is it going to be used in some kind of way that's not so beneficial to them?
So great question, Pierre. We get that question a lot. So where does the data go? Who owns the data? If there's a wearable that UNICEF is using, does UNICEF own the data? I think the answer to that question is, right now the systems that UNICEF have built, especially around technology innovation, have mostly been opt-in. And a lot of these devices are also opt-in. But then when you create these systems, as we were talking about, that become sort of passive in their collection or whatever, where does that go? And so, the first question is, why do wearables for social good and impact? Well, we do need to create these new nodes in this existing development network that can help deliver these services where resources are constrained, et cetera. But then what? So how do you manage that data? Where does it live? Who owns it? Does the person that is getting that data tracked on them, do they have access to it, especially when they don't have access to the internet? Someone's not going to sit down and sign on to their a la Fitbit app per se if you're in like rural Rwanda, right? So for us, I think this is one of the questions that we are seeking to explore. One of the focus areas in our challenge was exactly that, was data insight and collection. And how can we make these systems better? What are the things that we need to look at? And understanding that, this is a problem it's well beyond just, the developed world and in the developing world as well. So how can we understand the need? How can we give confidence that the community gathered data will actually trigger response and recognition? How do we then empower the people who have the data, say a community healthcare worker, et cetera, to collect it and submit it in the right kind of way so that they're not overwhelmed in their job? And how do you then take that critical information and transmit it back in, say, situations of emergency, etc.? So all questions that remain to be seen, which is why we do need to develop these systems and networks and look at it in a ubiquitous way. So a solution that can be applied in Baltimore can also be applied in, Bujumbura. So how do we do that? I think it's an open-ended question. We're definitely challenged, and I'd say that we do try to meet the data constraints of the countries, insofar as the rules and things that they have. But a lot of people then say, well, what if you don't trust that system, if governments are helping you, et cetera. So all things that we're trying to look at, and again, back to knowing what we don't know, we are trying to figure out answers to those questions.
Teresa, sorry, I may be slightly better. Did you have? I'm seeing apps opening up and questions happening. It's a lot of moving parts right now. Teresa, did you have anything that you wanted to add to this?
Yeah, 2 quick comments to follow on Autumn and Jacqueline. So I think one of the great promises or opportunity about wearables today is that it isn't tied to the system or the traditional healthcare system. So you don't think about hospitals, you don't think about schools, you don't think about like your YMCAs. Like it is coming from like a consumer electronics angle, which positions it completely differently. And I think that actually opens more doors for access, because people view it as like a cool, trendy thing. And then I think there's another opportunity, like a second layer of opportunity to really impact your health. But it's interesting, and I think it's exciting to come from a consumer electronics perspective, because it's not tied to the system, and it's not tied down by the bureaucracy or the stigmas that you have of like wearing a Fitbit doesn't mean you're a patient. It just means you care about being active or you care about your health, and it's actually trendy and cool. So I think that's actually a really interesting distinction to make. And then I think to that point, because wearables are consumer electronic, you see a generational divide. So young people or younger generations are much more comfortable sharing their data and are a lot less worried about what their data is being used for, because now we have every app asks you to share your data or like connect via Facebook, and most of us don't even think twice by saying allow or continue. And so I think that's opened the door to a lot of data collections and data aggregators, but a lot of the older generation, the older population have stigma and concerns around medical theft and identity theft, and those concerns are very real, as with all the insurance breaches and hospital breaches. So I think it's managing expectations from your 2 different populations that exist today, and really figuring out, to Jacqueline's point, having that infrastructure that can securely store all of this data and eventually find a use case for it.
Right, I appreciate your comment about the fact that coming from a different space, if you are not coming from the healthcare space, coming from the consumer electronic space, opens up the possibilities with respect to not only the accessibility potentially, but also use and interoperability. So how effectively something that's health related may impact something that may have been considered to be specifically about just what we buy, but it has a health impact, and so there's some connection there, but it may not have been a connection that folks in the health sector had specifically thought about, because there's a lot of siloing that goes on, particularly in public health, and we need to be broken out of that to some extent. So working more effectively with people who are in these different spaces, I think, is useful. A couple questions came to us from the listeners. One of them is, how can pharmaceutical or biotech fields develop better point-of-care and adherence programs through wearable technology? We could probably take the next hour discussing this one particular question, but I know, Jackie, you mentioned some of this a little bit before. I don't know if anyone else has got thoughts on this for a couple minutes. We're getting down to the last 10 minutes or so of our conversation, but any thoughts on developing better point-of-care and adherence programs? Any highlightable models that you are aware of? Anybody on the call to answer that question?
Sure, and I'll just make this quick because I know we have a few minutes, and I'd like to hear the thoughts of the others as well. I don't know if that it's anything really innovative other than pharmaceutical companies getting closer to the patient when they are in the hospital. One of the things that has been happening more and more is the partnership between Walgreens and a hospital, where a Walgreens farm tech will actually be at the bedside with a nurse before a patient is discharged to do medication reconciliation and to have that prescription filled before they walk out of the door, so that they don't end up with a 30-day readmission over the next couple of days. That seems like, well, it's one of those things that happens in healthcare that's sort of a we haven't been doing this all along kind of thing, but for the industry, it's innovative. That's the closest thing I can think of to innovation. But I would like to hear what the others have to say, particularly Teresa, because I'm not really sure what else they could do besides just get closer to the patient.
Yeah, I think that's a really important step for the biopharma community, like learning to engage their patients, and I think they're actually taking big strides in that direction. So creating apps to follow their patients along the journey. So almost every single pharmaceutical company has a distinct app for a distinct disease or medication to help them, track and adhere. But even beyond that, they're learning to leverage kind of mobile health or wearable data to do more frequent check-ins. So, one popular clinical endpoint is kind of the 6-minute walk test, and now that they can use a wearable to kind of verify those motions versus having to go into the clinic to see the patient and doing that like once a month. Now you can ask them to do it, once a day, and they can do it in the comfort of their home, and you can preemptively see if there's a negative trend there. So I think a lot of the challenge for a lot of the biopharma companies will be figuring out what they can do remotely and what is accurate enough for them to reliably intervene before it becomes too late. And I think I'm excited because I think a lot of these companies know that it's a problem they're facing, and they're making a lot of effort to work with its startups and new companies to get there.
Any other thoughts on that end of things? Blair, does this biotech sort of patient engagement piece touch your work much at all?
It does some. I mean, we were thinking, how can we look at wearable and sensor technology for diagnosis, treatment, and referral? So specifically, like, around HIV or things in emergency situations like Ebola. So I think that the onus can be somewhat on the pharmaceutical companies, and I agree with Jacqueline that to be at the patient-centered sort of place is where you can start. That is harder in the types of settings that we work in at UNICEF, but if you have the technology that can allow for at least the exchange of information, then perhaps those people can get into treatment faster. So we can look at that, across things like HIV and infectious diseases and preventable childhood diseases for sure. And I think that those are areas that we'd like to explore. If it's in concert with pharmaceutical companies remains to be seen. I know that there are doing many around adherence for HIV drugs and tuberculosis, et cetera. So there's a lot of experimentation going on right now, but nothing that I think's been scaled to a level that would show true impact yet. But I think it's getting there.
Good stuff. The next question was one regarding whether or not wearables offer a reminder to perform fitness or other goals that have been missed. And I know from personal experience with a couple of these wearables that some of them do, and some of them do it somewhat obnoxiously. You haven't run today, or when are you going to get off the couch? That sort of commentary. And we talked a little bit about people being reminded to take meds and stuff like that. The reminder element of this thing is really probably a big part of it. Are any of you aware of any particularly innovative or interesting ways that people have been incentivized either by the device itself or by other methods? And Autumn, I know you've done a lot of community-based work, as we said before. Any thoughts on that incentivization piece or nudge?
Yeah, so I mean, I know just kind of looking at this, how it's changed is that a lot of larger organizations are using this to incentivize, personal physical activity or nutrition changes by, lowering, insurance deductibles or insurance rates according to what happens and if that's being checked. Definitely using it for people that work for an organization if they're borderline diabetic. So I know there's been a lot of connections between, systems like work systems using this, giving folks these devices at a cheaper rate to help everyone kind of save money. But, one thing that I kind of wanted to point out, that we've been kind of playing around is that, it's not just these devices, but what about the extreme amounts of money that these devices are really promoting. So if you think about what Fitbit just went public and it's valued at what, $4.4 billion now, right? So if you think about technology, and I know Teresa had said this, is that, these pieces, because they're coming from a consumer kind of basis, that people aren't thinking about the connections with the system, or we may not even be able to touch large health inequities. But if we think about that money and how that money can then come back to communities through philanthropy and really help out, this is a tremendous opportunity that can help communities get to the roots of these issues. So not just if you're eating well or if you're being physically active, but opportunities for equitable education or opportunities for clean and fair and affordable housing. We can all pick up that bad that horrible example of Facebook and the $100 million that went down the drain in New Jersey, right? But think about if that $100 million went to evidence-based social determinants of health work, right? So if there would have been an investment in housing or these integrated connections to healthcare and house when it comes to young people and asthma, right? These things that we know get at these social determinants and get at these inequities. Being given this money, all this money that's being generated, I think is a wonderful opportunity where these wearables and this technology can improve population health and not just focus, on individuals. So, that's just something that kind of popped into my head of, the funding. There's a pay for success model where private industry comes in, pays for, develops what are the outcomes, nonprofits or small companies or small community-based organizations actually do the work and then are paid back to be sustainable by the money that the government saves in not having recidivism or not having some of these social ills that end up costing the system more. So that initial investment by private companies can really start to get at these ills that a lot of these communities face.
I don't think we could have asked for a more appropriate way to sort of encapsulate and give us this platform on which to think about this from a totally different level than we might have come into the conversation at the beginning, where we were really thinking and talking about the things that we might wear on our wrists, to now ultimately talking about multi-sectoral systems changes that impact lives in a number of different ways, not just from a health perspective, but also from an education perspective, housing perspective, etc. So thank you very much, Autumn, for that comment. And we are at the end of our time already. I know that this is sort of flown by, and I really appreciate all the comments that were made and the feedback and actually the preparation too. There's a couple people offline that you can't see. Emily Newhook is back there somewhere. Thank you very much for all of the hard work that you did in putting this thing together. Teresa, Jacqueline, Blair, Autumn, thank you for your comments and your engagement. Hopefully there's some good interaction that's going to continue beyond this. Sorry, and Sophia too. Sorry, I'm getting these little side notes. Looking forward to hearing from you, the folks who tuned in as well. Thank you for the questions you sent in. If you've got any others, then you have a link to reaching out to us either through Twitter or maybe even through some other portals I think that the MHA program may have set up. just stay tuned for more of this sort of conversation. Let us know what types of things you might want to hear about, and ways that we can sort of push these conversations forward. But thanks again to our participants and to all of you for joining us today, and we look forward to catching up with you. And if you are wearing a wearable and you've been sitting down watching this for a while, it's time to get out there and go run or something. Got to get your points in. All right. Take care. Thank you.